Welcome to our show, Coffee with Chris, where you're going to hear educational resources and information about home care to make sure that you get the right care you deserve. Today's topic, we're going to talk about the differences between home health care and private duty home care. Not all family members understand the differences. We get calls all the time about families who think that private duty services are covered by insurance. So let me explain to you just the differences so that way that it can save you time when you're deciding on the right home care company. So let's start out with home health care services. Home health care services have to be licensed in the state that they're in. Here in Michigan at Affinity, we are state licensed and we make sure that we follow all of the insurance and state guidelines to make sure that we provide the right care for you. The employees that we provide to make sure that you get the right care are registered nurses, physical therapists, occupational therapists, speech therapists, medical social workers, and home health aides. In order to receive this service, you do need to talk to your physician to make sure you get a script. You might be at the hospital and talk to a social worker or a case manager, and they might ask you what home care company you like to select. You have the right to decide on the right home care company, and you can choose and tell your social worker leaving a rehab or a hospital and make sure that we coordinate the care that you deserve. That referral will be sent over to us and we do an insurance verification to make sure that we accept your insurance. Medicare, if you do have it, covers 100% of your home health care services. And if you do have another insurance, make sure you call to make sure that we can provide the right care for you. If not, we'll make sure we send you off to the right place that does. Now, let's talk about private duty services. Everyone thinks that Medicare services are covered by private duty services, but that is not true. At this point in time, Medicare does not cover 100% of your caregiver services and most insurances. The only scenarios that really do are long-term care insurance policies like John Hancock, CNA, Genworth. Those are just three for an example, but there's many more. You can call us to make sure that we can do an assessment to get you pre-qualified to have your long-term care insurance provider cover your caregiver services. Another is auto. Auto covers all health care, home health and private duty as well. So if you're involved in an auto accident, your auto insurance will cover your care in your home. Also, Medicaid, not Medicare. Medicaid does cover in-home helper services. They call it in-home helper services, and DHS, you call and make sure that they send a nurse out to your home to make sure that they can see how many hours you get pre-approved for. We can't guarantee how many hours that if you need, whether it's 4, 6, 8, or 12, you'll get that. It's all dictated by the insurance company. And it's important to understand that private duty is private pay. There are caregivers that come and you are billed by the time that they're there. So we can get a little bit more detailed about all the home health care, private duty services a little bit later, but this is just to let you know about there are differences, and you can call us. We're available at any time to discuss these differences of home health care services. Take care, God bless, and welcome to our show, Coffee with Chris.